of Women's Health Institute, and I'm here to explain how we approach pelvic pain coming from a brain health and nervous system health and pain science perspective. So we'll talk today about reducing pelvic pain with a brain-based approach to pain relief and our overall holistic approach to pain relief. So what we'll be talking about today is optimizing the brain environment to allow for easier and more complete pain relief, coming from using tools of nutrition and lifestyle medicine. We'll also talk about what I call social environmental toxicity, because we're going to be focusing on pelvic pain primarily in women, and much of this will also apply to men, but women live in a particularly stressful social environment that I think it's important to address, and history of trauma, which of course can happen for both men and women. Signals of safety to the brain. So ultimately, our focus here is focusing on how much safety, how many signals of safety from all the different systems, physiologic, psychosocial, we can supply to the brain to optimize its functioning, the nervous system's functioning, and then utilizing other techniques for pain reduction. So as we send signals of safety to the brain, we're also focusing on stress management, hormonal balancing of the hypothalamic pituitary adrenal axis, and the interaction between the brain and the gut brain and the microbiome that lives primarily in the colon. And I'll introduce pelvic floor rehabilitation when that is done in this context of a nervous system and a brain that are bathed in all of these holistic safety signals, how we can improve effectiveness of pelvic floor rehabilitation. So I like to think of the pelvic floor as a bowl, a very interesting bowl from a physiologic standpoint. So in functional nutrition and physiotherapy, we're taking a root cause, holistic approach to reducing pelvic pain, which can be associated with endometriosis, IBS, IBD, irritable bowel syndrome, inflammatory bowel disease, vulvodynia, sexual pain of any kind, interstitial cystitis or bladder pain, pelvic floor dysfunction, or even musculoskeletal pelvic floor pain and other musculoskeletal, perhaps traumatic or chronic illnesses in the pelvic region. So because the pelvis is literally a musculoskeletal bowl that houses all of these systems, it's essentially built by bones and joints. There are clearly nerves coursing through the pelvis. There's a vascular system. The bladder and urethra are two of the organs that are housed. The uterus and reproductive organs, colon and rectum, and pelvic floor forms the base of the bowl. And then energetically, and I'm going to get just slightly woo-woo here, this is the root chakra, to the energetic area where women and men carry that safety energy and grounding energy. Pain is always a decision that is made by the brain. So there can be significant tissue damage in the pelvic region or very little tissue damage in the pelvic region. And there can still be, with very little tissue damage, there can be a very intense pain signaling, or with quite a bit of tissue damage, there can be less or even no pain signaling. So the decision for the brain when it decides to create a pain signal has somewhat to do with nociceptive receptors in the pelvic region, actual tissue damage, but it also has to do with other messengers, hormonal messengers, neurotransmitter messengers, inflammatory cytokines, and all of the factors that are local to the pelvis, but also these mediators that are factors specifically, is the brain bathed in safety signals that are physiologic. So it's, for example, low in oxidative stress, low in inflammation, but also low emotional stress, because all of these factors, whether they're biologic or psychosocial, really impact the combined, there's all these signals coming into the brain, and at some point the brain decides whether or not to output a signal of pain. And while local tissue damage and local nociception are factors, they're not the only factors. So in the modern neuroscience approach to pain, it's understood that while pain can be provoked and perpetuated by local tissue damage, the decision for the brain to give a pain signal is based on many factors, including the severity of injury, hypervigilance, fear, inflammatory cytokines, and even sensations of access to healthcare or not. Does this woman feel like she is going to be able to pay for and find and travel to the practitioners that she needs to help her heal? Pain is an output of the brain that is produced whenever the brain concludes that a body tissue is in danger and action is required. Pain is a multi-system output that's produced when an individual specific cortical plan neuromatrix is activated. So what's a neuromatrix? Well, another name for a neuromatrix is the neurotag. Neural representations networks, so there's all of these networks in the brain, otherwise known as neurotags, are large groups of brain cells that are distributed across multiple regions of the brain, the hypothalamus, the frontal lobe, all over the different areas of the brain, and are thought to evoke collaboratively a given output. Each neurotag consists of numerous brain cells. Each one is called a member brain cell of that neurotag, and each member brain cell is part of multiple neurotags. So the metaphor that's often used is that of an orchestra, right? So each musician is like the member brain cell. Collaboratively, these musicians will come together to perform certain pieces, but within the orchestra, when different pieces are played, different members can be a parts of different neurotags. So that may change depending on which piece of music is played. So the same thing with the brain, one particular member neuron can be a part of many different neurotags depending on the brain output that's desired. So you can see here, and there are many primary neurotags that output particular feelings, beliefs, sensations, movements, and those primary neurotags, those little orchestras little groups of musicians putting out particular pieces of music, can be influenced by secondary neurotags and multiple secondary neurotags. So while learning a new sensation, belief, or movement doesn't overwrite the prior neurotag, it still exists, it's possible to sort of wire around the old pattern and create a newer, stronger, more active, more influential neurotag. So an older neurotag, that's not used as much anymore, can be superseded by a newer, faster neurotag. So what we're trying to do is when there's a pain situation, we're trying to wire around that so a non-pain sensation can be more readily activated. Structural and functional changes in the brain can occur with practice, learning, and exposure, changing the neurotags that are most readily activated. So the old neurotags might be still there, but they're just shut down, not working very efficiently. And so we see from a number of research papers that have been done in sports and music primarily, that when people practice very specific skills over and over, there are structural changes, structural plasticity in the brain such that larger gray matter areas are formed, are strengthened, if you will, in different parts of the brain with different kinds of practice. And there are also changes in the functioning, so functional plasticity. For example, when you practice over and over a racquetball, the cortical representation of the hand that's used for playing becomes larger in those who are professional racquetball players. And there are changes in efficiency of cortical processes with practice. So what we're trying to do in pain rehab, and pelvic pain rehab in particular, is practicing physical sensations of less pain by relaxing the muscles of the pelvic floor, by moving or changing sexual positions that are less pain evoking, and doing it more efficiently in the context of a brain and nervous system environment that are bathed in biochemical safety signals, such as we change nutrition and things of that nature. So let's talk about the process for most efficient pelvic pain relief. Number one, we start with nutrition. So in our institute, we've developed something called the pelvic pain elimination diet. There are actually 4 of them. They're evidence-based, seasonal, whole foods nutrition elimination diets with a focus on mindful eating and on pleasure. So we take away the hypervigilance and the fear that can be evoked when people are given more restrictive diets, even for the short term. Then we look at all of the lifestyle medicine strategies that we can use. Sleep hygiene, sleep strategies, circadian rhythm balance, HPA access support. And this is done with lifestyle medicine, anything from blue light glasses to supplementation, sleep supportive supplementation, digestive function optimization. So we might use glutamine or zinc or particular strains of probiotics to optimize the gut microbial balance. Thyroid and sex hormone balance. Again, we might use anything from optimizing HPA axis function to giving supportive Chaste Tree Vitex or maca for estrogen and progesterone balancing. Elimination and detoxification needs to be supported. So is this client intaking enough fiber, enough water? Do they have enough active B vitamins and other liver support nutrients? How is their immune function? In most cases in pelvic pain, we're reducing autoimmune reactivity or excessive inflammation. Sometimes there are chronic low-grade kind of dysbiotic infections such as chronic yeast or chronic bacterial vaginosis infections where the immune system can be harnessed to help rebalance the microbiota of the vulvovaginal canal. And we look at neurotransmitter balance. So in particular, all of these nutrition, supplement, lifestyle medicine supports are designed to optimize the functioning of these various systems. And when these systems are functioning really well, then the brain gets a signal of, it's like, okay, check, safety, safety, safety in all of these systems. Additionally, we provide health coaching for building webs of support, whether that's professional healthcare teams or people at home to help support on those days when this is one of those silent, invisible illnesses sometimes, and people need help with cooking and childcare and support at work, so that they can reduce fear and hypervigilance around the condition, interrupting the functioning of their lives and making sure they have support for those days when it's difficult, because it's, as we all know, not a straight line to healing in almost any case. And then, of course, pelvic specialty physical therapy or physiotherapy. So neuroplasticity is enhanced with anti-inflammatory, antioxidant, immune supportive, and neurotropic nutrition. And so we start with that specific pelvic pain elimination diet, plus some other helpful strategies are caloric restriction, intermittent fasting, supplementation with polyphenols, supplementation with omega-3 fatty acids, and making sure there's nutrient abundance. Again, another safety signal to the brain is just the abundance of the raw materials that the neurons need to function, and of course quenching any oxidative stress so that the mitochondria of the neurons can function most efficiently as we're trying to rehab the movement and sensations. And certainly, if there are any chronic deficiencies, those need to be overcome. And they are quite common. Chronic nutrient deficiencies are quite common in pelvic pain conditions. For example, vitamin D treatment has been shown to improve endometriosis in a rat model, and increased vitamin D intake was related to a decreased risk of incident endometriosis. Vitamin D is also favorably associated with primary dysmenorrhea, uterine fibroids, and ovarian reserve in late reproductive age women. Adolescents and young women with severe dysmenorrhea also exhibit higher rates of calcium and vitamin D deficiency. So making sure that the system has adequate vitamin D lowers the risk of pelvic pain and can help improve it. Omega-3 fatty acid levels tend to be lower in women with endometriosis. In mice, omega-3 fats can reduce the number and weight of cystic endometriotic lesions. Women with high serum EPA, which is one of the fatty acids in fish oil, are 82% less likely to have endometriosis. And so while the small and scattered data, and I gave you just a few examples about nutrient deficiencies in pelvic pain, don't give us enough information to think of nutrient repletion as a pain treatment in the same way that we would think of anti-inflammatory herbs or medications, pharmaceuticals as a pain treatment. It's important to understand that optimizing nutrient levels supports health, which in turn supports relief from pain and other symptoms. Again, giving the systems the raw materials that they need, the nervous system, the immune system, the digestive system, the endocrine system to perfectly function, of course, is going to help us resolve symptoms. Thus, even though a multivitamin and multimineral supplement or even a high dose of a specific nutrient is not a magic pill for pain relief, consider that optimizing nutrient density over time supports immune and nervous system functioning and thus, again, biologic safety signals. So, what do I mean by safety signals? So in Mosley and Butler's famous work on pain, the books Explain Pain and The Protectometer, patients are educated to reduce what they call danger in me, or DIMS, and safety in me, SIMS, signals in the brain to reduce pain. So a danger in me signal would be a constant kind of fear-based response, emotional response to the pain, or eating an inflammatory diet, from my perspective, right? Increasing the inflammatory cytokines, or maybe over-exercising to the point of evoking the pain. Whereas safety in me signals are going to be things like, okay, I'm recognizing that I have some pain right now. I have a number of tools and strategies to modify the pain. I have plenty of support today. So if I need to rest, someone's going to pick up my kids from school and help cook dinner. So, it's going to be fine. Even if I have a little pain, I can get through it. I can still do my rehab exercises. I can still take good care of myself. And in a few days or less, the pain will likely resolve or reduce. So, that self-talk and those resources and strategies combine to input danger or safety signals for that particular patient. So clinically, for women with pelvic pain, safety signals are physiologic, psychosocial, and environmental. In many modern societies, even, women still face significant daily risk of abuse, sexual assault, and harassment. This low-load social environmental toxicity that is primarily a challenge for women, although it certainly does exist for men, and especially for women of color, makes it more challenging to convince the nervous system that there is this safety in day-to-day living your life and going to work where you might be harassed again, or being around someone who is a former abuser, or being around someone who might be an abuser, or just the day-to-day harassment that you might get walking to work or being on the subway or something like that. So, and at an extreme level, 1 in 6 American women has been the victim of an attempted or completed rape in her lifetime. And this is reported, and we know this is very much underreported. The problem is worse for transgender people and for Native American women. So again, this is an extreme example, but how many women every single day are sexually harassed at work, have history of sexual abuse, have history of any kind of abuse. So sending signals of safety to the brain to reduce pain beyond nutrition includes social advocacy to reduce the day-to-day harassment, abuse, and assault risk to women and other vulnerable populations. Lifestyle to induce a safer environment in the brain. So reduce stress balancing techniques, normalizing cortisol rhythm, hormone balance, gut microbial balance, all of these systems interplay with one another. And we use the full toolbox of lifestyle medicine, support, and advocacy to bathe the brains of women in safety signals individually and collectively. So this is also essential for preventing new cases of chronic pain. So teaching women, advocating for women, as young as possible, and certainly around the time of puberty, whenever possible. In those with a history of at least one adverse childhood experience, otherwise known as an ACE, 80% of youth with chronic pain reported at least one ACE in their lifetime. Multiple and univariate analysis of variants reveal that ACE exposure is significantly associated with greater symptoms of anxiety, depression, and fear of pain. And fear is one of those danger signals that actually makes the intensity and consistency and volume of the pain worse, because again, that pain signal is a decision by that entire brain neurotag. So in the stress response system, that you get impacts not just to the stress hormones. So if we look here, there's a stress signal, whether that's inflammation or emotional stressor like a fear. Maybe you see that person who abused you or that boss who's constantly harassing you, then the brain releases signals triggering the HPA axis, hypothalamus pituitary adrenal axis, to release cortisol as a stress buffer. Over time, this system will be strained and either cortisol levels will become out of balance. So the rhythm will be off. They should be high. Cortisol levels should be relatively high in the morning, drop off through the day. But that can flip where, someone kind of wakes up with high cortisol and then wakes up with low cortisol. And so they're very fatigued. They're fatigued all day, and then they get that second wind at night, or the cortisol is high all the time. They're kind of always on guard. And eventually the system can be somewhat worn down. The whole system can have a lack of raw materials. And, then the cortisol levels are low and people can have chronic fatigue-like syndromes. And cortisol doesn't just interact with that mood and energy and just cortisol, but also impacts the gut lining. So it can become, the digestive lining can become more permeable. It can impact the composition of the enteric microbiota. Inflammatory cytokines are stimulated by the immune system. With cortisol stimulation, neurotransmitter changes happen, vagus nerve toning is impacted. So this stress response system impacts many different systems: the endocrine system, the nervous system, the digestive system, the gut microbiome, the gut brain, neurotransmitters, and the immune system. So one of the tools we have to modulate the stress system to help tone it, calm it, have it be better responsive and not over responsive, is to optimize vagus nerve toning. The role of vagus nerve health in pain modulation has to do with its role in the parasympathetic nervous system. More intense chronic pain is associated with lower sleep quality and alterations in mood. Vagus nerve toning can help to improve autonomic nervous system functioning. And there are many great ways that are free and easily available to tone the vagus nerve. Also coming out, there's more and more research on vagus nerve direct stimulation tools and strategies. Also, there's this bi-directional communication between the gut microbiome and the enteric nervous system, the gut brain, the nervous system in the digestive system, and the central nervous system. And from animal data, ultimately, we understand that the microbial content of the GI tract, so the gut microbiome in the colon, is critical in youth to the development and even at birth and even, an infant and early childhood, to the development of an appropriate stress response. So imagine if someone has a history of child abuse or childhood sexual abuse or just neglect or, just not born into a loving environment, their stress response system is going to be less resilient from the start. And of course, there are other times of vulnerability, such as puberty and pregnancy, that the stress resilience system can be altered by the composition of the gut microbiome. So if the gut microbiome is not nice and balanced and healthy, that impacts stress resilience, which of course impacts pain resilience. So what does this mean for pelvic pain? Well, the thing is that there's a lot of overlap between gynecologic and bladder visceral pain with GI visceral pain syndromes such as IBS and IBD. Those with chronic pelvic pain have about double the rates of IBS as control subjects. Abnormal gut-brain microbiome axis can predispose someone to heightened stress response, as we just discussed. And when we have either elevated, dysregulated, or depressed cortisol levels, that is often seen in chronic pelvic pain at various stages, and it varies between men and women. And there's a general increase in systemic inflammation when there's an imbalance in the gut microbiome. So that's definitely something that has to be addressed because it impacts the functioning of the brain and nervous system. Certain serotonin receptors are specifically related to visceral pain, and this was tested by colorectal distension in rats. And certain genetic polymorphisms in the serotonin receptor gene have been associated with musculoskeletal pain conditions in other parts of the body, particularly in TMD dysfunction in humans. So if we can support increasing serotonin to healthy levels, which is of course modulated by estrogen, then again, we're helping support an optimal safety environment in the brain. And there are many non-pharmacologic methods for increasing serotonin levels, including thought retraining and noticing what the core root factors for depression and anxiety, anything from lack of social support, limiting beliefs, HPA axis dysregulation, as we've just talked about extensively, CNS hypersensitivity, abnormal gut bacteria, digestive function issues. All of these can underlie depression, anxiety, or other mood issues that can give more danger signals in the brain. Other things that help support serotonin levels, exposure to bright outdoor light. So how many of our clients just are lacking? They're spending tons of time in front of a screen or a computer, but they're never going outside and exposing their eyes without sunglasses to actual daylight. That's very nourishing for certain parts of the brain. Exercise, including exercise to fatigue, which we wouldn't necessarily do in patients with chronic pelvic pain, but exercise in general increases plasma tryptophan and decreases plasma branched chain amino acids. These branched chain amino acids inhibit tryptophan transport into the brain. So as we change that amino acid availability, which we do with exercise, it favors the transport of tryptophan, which is a precursor to serotonin, into the brain. Pelvic function has an important impact on patients' lives. So we have to think about the stress that's evoked when someone can't sit, stand, walk, toilet, have sex, birth, move without pain. That's highly stressful, and it's going to impact that HPA response, which of course has influence over the brain, over the immune system, and over the endocrine system. Whenever the pelvis is in pain, even basic self-care functions are impacted. So to support patients with pelvic pain to return to full function, pelvic floor rehabilitation is often necessary. In the context of a healthy brain, and understanding of pain neuroscience by the patient, which is why patient education is such a key part of pain rehab, pelvic floor rehab will allow patients to begin to move better, relax their pelvic floor, find comfortable sexual positions and situations, reduce constipation and IBS symptoms, reduce bladder inflammation, autoimmune irritation, and improve vulvar tissue health with the support of a skilled professional. Because again, we can support relaxation of the pelvic floor. We can support blood flow and lymph flow in the region. We can support neural mobilization. So what is pelvic physiotherapy that will address this? Essentially, it's the exposure therapy part. So we've already kind of bathed our brain in all these biopsychosocial safety signals. Now it's time to expose the pelvis and surrounding organs and tissues to functional movement, even sports or high-level movement, rest, sexual function, bowel and bladder function with little to no pain. So it depends on the client's unique goals, but we start low, avoid fear of pain, avoid avoidance of activity, and induce a slow, safe progression of functional movement, which can be increasingly challenging or increasingly loaded with weights or other stressors, dynamic stressors. Lots of education on anatomy and physiology of the pelvic floor, pain-reducing sexual positions, how to move with less pain, motor relearning education to help clients to relax the muscles of the pelvic floor. And it can involve internal, intravaginal, or interrectal techniques to reach some of the, you'll see there are deeper muscles of the pelvis that are really only able to be accessed by doing manual techniques that are through the vagina or through the rectum, reducing also neural restrictions. There are quite a number of potential nerve involvements in the region, and reducing myofascial tension, improving circulation, improving lymph flow. So that involves manual therapy, but also pelvic and full body exercise, movement retraining, biofeedback, and other modalities. So in summary, as we work with women to overcome pelvic pain, it's essential to take a system optimization approach, specifically supporting a nourished brain that is more susceptible to healthy neural plasticity because we've quieted that inflammation and quieted that oxidative stress and supplied all the raw materials necessary, bathed it in biopsychosocial safety signals, then overlay or collaboratively overlay pelvic floor rehabilitation and other therapies. Sometimes other therapies are necessary, such as things like endometriosis excision surgery, which is outside of the scope of this presentation, but important to be aware of. And that allows these other therapies to become, when we take this brain-based and systems-based and nervous systems-based approach, allows these other therapies to be even more effective for reducing and eliminating chronic pelvic pain when that nervous system is collaboratively supported in this holistic manner. Thank you so much for being here with me today. I hope you enjoyed this presentation, and I look forward to seeing you soon. Thanks. Bye-bye.